I've answered this question in various ways, but let me bring it together for you. The question is, are painful period cramps normal? What level of pain is normal? Does it change with age? And is there a way that I can manage? Well, period cramps can be normal, but not if they're impacting or interfering with your life. Because if they are, there's a way to get some help. So, period cramps are related to there's an increase in prostaglandins and there's an increase in contraction of the uterus, literally like labor contractions of the uterus as it sheds the endometrial lining. So, the prostaglandins and the contractions can cause significant dysmenorrhea or period related pain. And if the periods are heavier and you're having to pass clots, sometimes that can be worse. So, what can we do about it? First of all, we want to make sure that there's nothing serious going on. So, could this be an underlying pathology, something like endometriosis or adenomyosis or some other cause of pelvic pain? And make sure you have that evaluated. But otherwise, if this is period related pain that is to the point of being severe, what are some of the things you can do about it? First of all, well, I won't go in order, but one of the most important things to realize is that you can suppress your menstrual cycle and not have a menstrual cycle. So if you're having pain during your periods, then suppress your menstrual cycle and don't have pain during your periods. It's really very safe and very easy to do. You can do that with something like a birth control pill or a combined hormonal contraceptive that you take continuously without taking the inactive or placebo pills or using the placebo patch, for example, or if you're using a vaginal ring without taking the ring out for a week to have a period, you just use it continuously. Now, do that under the supervision of your doctor because you want to make sure that you're not getting too much accumulated hormone in your system, but it's very safe to do that. Most often, I would recommend doing that with a low dose birth control pill because that's where we have the most experience with continuous dosing and not having a cycle for even up to a year or more. So, if you're having period pain, you don't want periods, don't have periods. The other way to help is to know that this is related to an increase in prostaglandins, and anything that's going to reduce prostaglandins is going to help with periods. So, Advil, ibuprofen, or naproxen, those are some of the prostaglandin inhibitors that will reduce the prostaglandins that are contributing to the pain and the other symptoms, such as nausea, vomiting, bloating, bowel symptoms, all related to prostaglandins. So you can either not have cycles or you can treat the prostaglandins and treat the dysmenorrhea and the pain with medication. There's other ways as well. So if you're going to take a prostaglandin inhibitor, I recommend you track your cycles and you start taking it at least 3 to 4 to 5 days prior to the onset of your bleeding. And especially if you start getting symptoms prior to the onset of your bleeding, you can start taking it a little early. Take it around the clock for the first couple of days to really allow it to build up in your system. And then prostaglandins can't really get too high and your pain can't get too bad if you get that in your system early. There are other ways, like an IUD, for example, can thin the lining so much that you don't have a period, but that would be a progesterone impregnated IUD, such as Mirena or Kylena or Skyla, versus a copper IUD, which is known to increase cramping and bleeding. So you need to talk to your doctor if you're thinking about an IUD. And there are other ways of shutting down your period that you can talk to your doctor about, but essentially those are the mainstays of helping with serious incapacitating menstrual cramping. Other things that you might think about, which often help, like a hot water bottle or a heating pad, like make sure you're really well hydrated, make sure you're moving your body, such as walks or swimming or gentle activity. Make sure you're getting enough sleep and eating healthy foods. All of those things are going to impact all of your physiology and also make your periods more tolerable. So it's a really long answer, but everyone has Every woman has periods. Almost every woman has periods. And almost every woman has managed period cramping. So I'm really hopeful that this lengthy answer to this really important question has provided you with some tidbits that will help. And don't forget to like, subscribe, and follow because this Ask the Doctor series is gaining steam and it's lots of fun.